Welcome to our Biomechanics video assignment.
We're going to teach you everything you need to know about the anterior cruciate ligament, or the ACL. Yeah, that's fine.
So, due to the two articulating surfaces of the femur and the tibia, the knee is a very unstable joint. It relies heavily on the surrounding muscles, tendons, and ligaments for stability. Adding to the stability of the knee, there are a variety of extracapsular ligaments. However, for the purpose of this video assignment, we are going to focus on the intrinsic ligaments, specifically the ACL. The anterior cruciate ligament, this one here, is much weaker than the PCL, and it arises of the anterior aspect of the condylar region of the tibia, travelling superiorly, posteriorly, and laterally to the medial aspect of the posterior lateral femoral condyle.
The primary role of the ACL is to check anterior displacement of the tibia on the femur, and also checks internal rotation of the tibia. The ACL can get injured in many different ways throughout various different movements. Some ACL injuries occur by forces, external forces hitting the knee, and some injuries occur with no forces and just the ACL put under shear stress. So basically there's a few ways in which the ACL can get injured. The most common way is when players are taking off or landing from a jump or changing in direction. This occurs in weight-bearing positions when you're flexed and either internally or externally rotated. So here we have Chris Judd when he did his ACL. We can see when he lands just there, his knee lands in slight flexion, his tibia goes into external rotation, which means that ACL is going to wind up around that lateral femoral condyle, and it's going to get taut, and then it's going to give way when he lands. So the second way you can do an ACL injury is through severe hyperextension. This way is a bit less common, but it's also likely to occur from awkward landing, stepping in a pothole, or from an interior force pushing back into the knee. Here we have a video of Robbie Gray in the ACL. When he lands, you see that severe hyperextension of that leg. With hyperextension, the tibia is forced anteriorly to a degree where the ACL can no longer withhold the stress of the movement, so the ACL gives way and tears.
So what are some of the implications if we have a ruptured ACL? In the short term, the stability of the knee is severely compromised, as there's decreased range of motion, there's an increased swelling in the joint as shown by the photos above, and there's also pain associated with the swelling. In the long term, we have the risk of injuring other structures like the menisci, there's cartilage degeneration in the joint and the patella, and there's also a very high risk of osteoarthritis. Without proper physiotherapy, the subject may not be able to jump, squat, bend, climb stairs, or even walk properly, especially on uneven surface.
So what sports are the ACL most likely to occur in? They occur in high impact sports that require staying low with a quick change of direction. These are sports such as basketball, footy, even skiing, and sometimes soccer. The ACL injuries occur in mostly contact sports, but they can also occur in non-contact sports. And this is because the most common way to do it is in that flexed position with slight internal or external rotation without any external forces. 70% of ACL injuries occur when a player in a sport has to change direction very quickly or has to land awkwardly from a jump. On the other hand, about 30% of cases occur from direct trauma and knocks to the knee in contact sports such as NFL and AFL.
In general, people aged 15 to 45 are the most likely to suffer from an ACL injury, as people in this age bracket are the most active, participating in sports at high speeds. A study found that 1 in 1,750 people in this age bracket are likely to tear an ACL. Statistically, more males injure their ACL due to higher male participation in sport. However, females have a higher risk of injuring their ACL due to having a wider pelvis, increased valgus of the knee, joint laxity, and higher hamstring flexibility.
A ruptured ACL ligament cannot regenerate or repair itself, therefore surgery is required. It is usually a 1 to 2 hour procedure, and it can be performed in more than one way. As shown here, incisions are made to access the inside of the knee. One for a small camera which provides a clear view of the joint, also supplying fluid, another on either side of the kneecap to access the joint, and one more to anchor the new graft into place. A probe is inserted to inspect the joint. A small shaver is added to remove the torn and remaining ACL tendon from the knee, cleaning out the joint, preparing it for the procedure. Furthermore, inspection for additional damage such as meniscus tears also takes place. Holes are drilled in both the femur and the tibia, creating tunnels for the graft to go through. It is measured so that the new graft is in place, mimicking the origin and insertion of the original ACL tendon. A choice of graft is used to replace the tendon. Depending on the surrounding tissue damage, the graft could be either from the patella, the hamstrings, or the quadriceps tendons. Graft is taken from the patient as it reduces the likelihood to rupture the tendon again. As we can see here, the graft is taken from the hamstrings. This is beneficial to the patient as the hamstrings have the ability to regenerate over time. The graft is always cut more than needed to disregard the challenge of not gaining enough. The graft is then placed through the tunnels, replicating the ACL tendon. Screws are placed in either hole to secure the graft. Screws are bioabsorbable, meaning that the body will incorporate it into bone over a period of time, further securing the tendon. Over time, the graft will undergo changes and will gain strength, aided by exercises and small movements performed by the patient.
So after undergoing an ACL surgery, the patient needs to go through a rehab program to help re-establish normal range of motion and flexibility in the knee, but also strengthening the knee and the surrounding muscles, resulting in normal function. The effect of the rehab program depends on how severe the injury was, how extensive the surgery was, and how well you actually follow the rehab program. I interviewed a friend who'd had an ACL surgery and who had actually gone through a rehab program, and he gave me information and an insight onto the rehab program. So what he reported to me was that straight after the surgery, a physio came into his room and gave him sort of basic exercises like quad tenses, leg raises, flexing the knee, which he did 5 times a day for about 2 to 4 weeks, which were just done to reduce the swelling and increase range of motion, to sort of get that knee back on track to normal function again. So we saw the physio for about twice a week for a month, again just to reduce swelling, get a bit of treatment and keep increasing that range of motion. And after about a month he started doing squats, single leg squats and hammy curls, which were done to build strength and muscle tone while also achieving normal gait pattern, strengthening the opposite limb and progressing with normal proprioception. And after about 3 months, he started doing weights for his legs, which again is just increasing the strength that are in the legs and to try and achieve full pain-free range of motion, and also progressive quadriceps, hamstring strengthening, and to enhance his proprioception and flexibility within his legs. He then started doing landing and jumping stuff to get movement into his legs so that he could then start to run after about 6 months. Now the running and jumping is specific to his sport because he's a footballer and he'll need his quadriceps and hamstrings to be at full capacity to achieve his maximum potential. So after doing those exercises, he started straight line running, which he was doing about 2 times a week, and also going to the gym about 3 times a week just to improve his cardiovascular fitness because he was a bit out of action with only having one leg pretty much. And then after doing that, he kept seeing the physio until the physio thought he was ready to start adding in agility training, which again is just trying to get the knee back to normal so he can achieve normal life goals and play sport that he wanted to. And he also mentioned that he saw the surgeon after about 1 month, 3 months, 6 months, and then 12 months just to test how the ACL was, see if the surgery was successful, and to see if he could participate in sport again. So we hope our video presentation has educated you on what the ACL is, what it does, how it's injured and when it's injured, and how it gets fixed.
Hope you enjoyed. Got it.